All right, so the next section is going to be regarding subjectives, putting in subjectives for patients. So remember, you have subjective, objective, assessment, and plan, and that is the SOAP note. Every medical professional knows what a SOAP note is. You as an MA, as a medical assistant, you're responsible for just the S, the subjective. So what's subjective? Subjective basically means what the patient tells you, right? So what the patient is telling you. Objective is what the provider goes in, does the physical exam, and they check on the patient and whatnot, and it's their findings. Oh, they have, inflamed whatever tonsils, they have a rash, they have red eyes, whatever. Those are their findings on objective. Next thing is assessment. So the assessment is kind of like a diagnosis. Like, oh, they have a fever, they have a sore throat, the tonsils are swollen, and then we're gonna run a strep test, and it's by, oh, guess what, they have strep. So their assessment is basically their diagnosis. Now, once you have a diagnosis, the key here is to get to a plan. What's the plan? The plan is, what are we doing for this patient? Are we giving them medication? Are we giving them a shot? Are we sending them to a specialist? Are we da-da-da-da-da? And that's something the provider will decide. But again, your responsibility is subjective. Most clinics, the vast majority of clinics, I think I mentioned this earlier, if you can master upper respiratory, URI, UTI, urinary tract infections, orthopedic type injuries like twisted ankle and whatnot, as well as things like rashes, maybe diarrhea, vomiting, stomach aches, maybe some lacerations, a couple of those things. Right there, you're 85-90% of what needs to be basically taken care of for most of the patients that come in. Right now, again, when you start out, I want you to stick to the template. Try to stick to the template. We have templates for almost everything that can be seen in the clinic. So these templates would allow you to know which questions to ask. Okay? Starting off, the first thing you always want to do is put your initials on top of the subjective. Once you come down, your subjective should always start off with patient presents to clinic with. Okay? Now, one little thing you want to be careful of is you don't want to say patient presents with UTI, because basically right now you're diagnosing them. They don't have a UTI. You don't know they have a UTI. They're presenting with, and then go with symptoms with frequency of urination, right? Lower abdominal pain, burning and urination, vaginal discharge or urinary discharge or whatever it may be. So you're basically putting the symptoms, right? So you're making it where it's kind of like a short little story, little paragraph, 5 to 8 sentences kind of a deal. Make sure it's grammatically correct. You have to make sure things are spelled properly, make sure they're sentences. Don't make up your own acronyms, your own words. Make sure it's nice and straightforward and giving the provider a nice little story where they know what they're going in to deal with. Okay? And keep something in mind. These are legal documents. These are documents that can be seen by other medical professionals that need to be transferred, or they may even be used in a court of law. So this is super important. Be thorough. Ask as many questions as you can that are basically relevant to the patient's presentation. Okay, so that's super important. But again, go through the subjectives, the templates, make sure you master them, and make sure you are thorough and complete. Now, if there's something that's off, a symptom that you can't find, something that doesn't fit, don't hesitate to ask a coworker, an MA, or the provider, or the patient said this, I'm not sure how to put that in. We're all here to help. It's basically a team effort.
Right.
Cool?
Cool.